I'm Dr. Julie Pham, founder of CuriosityBased. We help people practice curiosity in the world, starting in the workplace, because that is where we spend most of our waking hours. Curiosity as a practice boils down to self-awareness, relationship building, and clear communication. So join us as we interview leaders to see how they use curiosity at work.
Hi, welcome to the Curiosity at Work podcast. I'm Dr. Julie Pham. This is the start of season 2. And today I am here with Janice Deguchi, who is the executive director of Neighborhood House, a community action organization. She's going to explain what that means. And she's been there since 2019. And Janice has had a long career in the nonprofit space. So really looking forward to hearing from Janice about how curiosity in the social service sector works. Welcome, Janice.
Thank you so much, Julie.
So, Janice, I actually want to start with a personal question. Who is one person in your life who has helped you, who has inspired for you how to practice curiosity at work?
Well, there's been so many people, and I think initially it was my mentors, like Alan Sugiyama, who was a school board member. He was just an activist, and really kind of inspired me to work in the social services sector. I really didn't know what that was. I was working at the Internal Revenue Service as a taxpayer service specialist, and
Wow.
it was 8 hours a day of really not feeling like I was making much of an impact on my community. And then to meet people, I joined a nonprofit board, like a working board, not with any employees or anything like that. But we were a nonprofit civil rights group called the Japanese American Citizens League. And it was just a welcoming environment for a young person in her 20s to meet other people that really made a difference in the Japanese American community. They were in Seattle, Washington, and Seattle was the birthplace of the redress movement. And so I met the people that were actually the ones that got that movement started. And it was really inspiring to meet people that were my heroes and sheroes, and people that helped introduce me to the world of making a difference in our community.
I remember Al. He was such an inspirational and energetic leader. And it's good to know that he was one of the many people, it sounds like, who inspired curiosity for you.
Yeah.
So, Janice, Neighborhood House is a community action organization. Can you explain what that means?
Yes. Community action is part of the civil rights movement. It started in the 60s under the Johnson administration's War on Poverty. And along with other really incredible programs like Head Start, Job Corps, nutrition benefits, all of those things with the intent to eradicate poverty. And so there are 1,000 community action agencies in every single county in the United States. There are 30 in Washington State and 5 in King County, where we serve. Our focus is primarily low-income immigrants and refugees, but also just people that are living in public housing, but just anyone. We serve people from birth to end of life with early learning, youth development, employment, housing, resource and health navigation, people that are unhoused or at risk of becoming unhoused, to live longer, happier, healthier lives. And we also do advocacy around social justice issues, as well as providing a lot of direct services to over 13,000 people here in Seattle, King County.
So then that community action, it's that you're part of a greater network of other community action organizations, and that's what differentiates you from being just a social service agency then.
Right. So as a community action agency, we have organizational standards that we all commit to and are required to meet. And there are many, but one that really stands out is our tripartite board. So our board is 1/3 people representing low-income communities. It's 1/3 elected officials or their designee, and 1/3 at large. And so that's really combining that, people, and with the idea that people that are experiencing poverty have the greatest participation and in the programs and services that are going to be impacting them. And so that's why a third of our board are people representing the communities that we serve. And that would be consistent through all of the Community Action Network. And we work together on advocacy around poverty issues, and we do a lot of training and resource sharing. A lot of us are quite different, but a lot of the similar programs that community action agencies offer include Head Start, weatherization, and utility assistance. A lot of us operate food banks, so they look a little bit different in each community, but it's also designed that way to meet the community needs. And so every few years, we do a community needs assessment and determine what are the communities, the services that would be best fit our community.
I can see that's a real differentiator. Having served on numerous nonprofit boards myself, oftentimes they don't have the people who are from the communities that are being served actually serving on the board. Interesting.
Mhm.
So tell me a bit more about Neighborhood House and your employee base. How many employees are there? What kind of functions are there? How do they work in terms of that remote or in person? Yes, please share.
So we have 350 employees. They're all employees. We don't contract. They're spread out throughout Seattle and King County. A lot of the work we do is in person. So we run early learning programs, center-based early learning programs. We run home visiting programs. We have after-school programs for youth. We help people obtain their citizenship and study for the citizenship exam. So we're doing a lot of in-person work. So a lot of our direct service is in person. But during COVID, we were able to get approval to do some of our work virtually as well. So we do healthcare navigation and Medicaid case management, and we help people that maybe they have a disability, or they need help with activities of daily living, or maybe they don't speak English, and so we help organize, transportation and interpreters and caregivers and all those things that we're able to do virtually now, and we can bill Medicaid for those types of services that keep people at home for as long as possible and healthy for as long as possible. So we have 350 employees, 40 different languages. So like I said, our community that we served are predominantly immigrants and refugees. So of those 350, I'd say 300 are doing some level of direct service, and maybe 40 to 50 are doing like IT, accounting, HR, fundraising, development, communication. So it's a pretty big organization. It's about a $37 million budget. We have about a dozen locations. We're embedded in public housing. We work with 2 housing authorities, King County Housing Authority and Seattle Housing Authority. And we also partner with 4 school districts, 13 college campuses. We are in WorkSource offices, which is employment security, our job search area. So we're embedded in throughout the community in many different places, serving people from birth to end of life.
Wow. So the vast majority being in that direct services. And do you have a big generational range with your workforce? We had Michael Byung from Asian Counseling and Referral Service on earlier, and he said that there are lots of different generations represented in the employee base there. What about at Neighborhood House?
Oh yeah, definitely. I mean, we have a handful of 30+ year employee veterans that have really dedicated their lives to serving their community. So definitely. And we also have a lot of young people too, our Gen Zers and everything in between. So just age diversity, racial, ethnic, language diversity, neurodiversity, all sorts of, LGBTQ, all sorts of people that we serve and that work at Neighborhood House. And we really pride ourselves on creating a welcoming culture that's inclusive of very, different religions and groups, and people come from all over the world to work at Neighborhood House.
Janice, can you give me one example of practicing curiosity that's particular to Neighborhood House or to the community action social service industry?
Yeah. So like I had mentioned, we serve a very diverse group of immigrants and refugees at Neighborhood House. And one of the challenges that we had been hearing from our staff was access to culturally responsive behavioral health care support. And so and it's just hard to get behavioral health care if you speak English. But if you don't speak English and you are not from this culture, and there's all sorts of nuance to behavioral health and mental health care. And so our question, I think we're curious about, was what would that look like? What would a culturally responsive behavioral health approach look like? And how do we respond to this need in our community of people wanting more behavioral health support? And so we were curious. We asked our staff, like, what would that look like to you? What sort of help would that look like to you? And what we found was that what our staff were telling us was that our clients really wanted, like, they're really struggling with just like your common behavioral health concerns, like depression, mild depression, just like, oh, I feel sad, or just I'm stressed, I'm anxious, just life. And it wasn't necessarily severe diagnosis, psychiatry kind of thing, but it was more of your common behavioral health disorders. And so what we did was we convened a group. We started with just the Somali community, and we convened a group of stakeholders from the Somali community, clients, partners, and we asked, like, how could we design a behavioral health intervention that would meet the community needs? And so we partnered with them to get their feedback and work with the University of Washington to identify a research-based, evidence-based approach that is used in refugee camps. And so it's an approach that's already being used internationally, and adapted that to the Somali community here in King County, Washington. And we piloted it for a year. And we're using it to, like, what are the approaches and what are the things that the community does, that part of our culture, that we can infuse into a behavioral health intervention. And so our hope is that we can then take that approach and duplicate it with other cultural groups and adapt and make that culturally responsive behavioral health approach available to more people, so that they can not only be healthy physically, but also healthy mentally as well.
So that practicing curiosity is thinking about the particular approach, not that the challenges are common, like you said, depression,
Sure.
and yet it's actually the approach. And I really appreciate how you went ahead and worked with formed a committee, and then ended up working with a local university to figure that out. That's really interesting.
Yeah, we were really excited about that. And it's something that doesn't require like a master's in social work, or you don't have to be a licensed clinical social work. I mean, this intervention that was adopted, it was a World Health Organization approach adopted to be used, like I said, in refugee camps by relief workers. It's not something that is like you have to have an advanced degree, because that is also a barrier for a lot of people being able to access behavioral health, is because the credentialing and things like that. But if there are some things that we can do that just makes people less depressed, more happy, more hopeful, then that is a benefit to the community that we serve.
It's not about reinventing the wheel. Sometimes it's about just borrowing an approach that worked in a different context and applying it. So, Janice, can you share, when is it difficult for you to practice curiosity at work?
It's so hard sometimes, because my own personality is kind of like, you have your list and you check it off and you get things done. And when you run into like a speed bump or a problem, and you just want to go in and fix it, and like, you think you know how to fix it, you approach it like, okay, we need to do ABC, get this done, get from A to B. But I think it's really beneficial to slow down, especially in Neighborhood House, because we are so diverse, and it's so nuanced. And like, if you come up with a solution, maybe that might work in another context, but at Neighborhood House, there's just so many other layers that you need to consider. And so it's really important to really slow down and be curious. And especially like for someone like me that has like, oh, I've been in this business for 30 years, I know how to fix this. But, kind of putting aside that, ego and being more humble and thinking about, okay, I don't know everything. I need to make sure that I'm really considering other people and how it might impact, and slowing way down before we try and implement a fix, because that fix could then create more problems. And I've had that happen too.
So when you're feeling that sense of urgency and that there's so many things happening, and I imagine right now then, is that harder than ever
Oh
to
yeah,
practice curiosity because of all of the things that are happening in our world?
there's definitely a lot of things for us to be reacting to right now. And yeah, it's really hard to focus on what are the important things. It kind of feels like everything's important, but you only have so much time. So really prioritizing those things that you actually have an impact on, and what are the things that we can actually impact and change.
And Janice, could you give a specific example of that time where you had to just slow down? And maybe did someone tell you that?
Yeah. Actually, really recently. So I have a director's team of about 14 leaders that are kind of like, we meet once a month, and we talk about different things and formulate policies and things like that. And we were planning a director's retreat this summer. And so and I've been in my role for 6 years, and I've had this team for like 6 years. And the question was, what is our purpose? And I just thought, really? We've been working together for 6 years. Some of you have been in your position for 20 years, and you're like, what is our purpose? And so I work with a great facilitator, and she's like, Janice, what is the purpose of this group? There's 14 people. Like, is it a decision-making group? Like, what is it? And I said, really, it's peer support and thought partnership. I'm like, oh, okay. Because people were coming to that group like, we're a decision-making body. Like, I get to make a decision. Like, they personally get to make a decision. Like, no, actually, we're thought partners and we're peer support. And I'm like, okay, that makes a lot more sense. And then, just that role clarity was really, really important. And that's going to help us, I think, the future, having better, collaboration as a director's team. But I'm like, oh wow, and we're getting really back to basics of like, what is the role of this director's team?
And when that was asked, did you have to pause for a moment and be, what is it? Because I know if that happened to me, it's just, but
Yeah.
wait a minute, what is it?
I
have to
know,
articulate
of course I know what the purpose of this group is. I did. And it didn't take me long to articulate that. But our facilitator is like, okay, great. I want you to say that to everybody. Like, okay. And that was, that's our focus. I put that on the top of the agenda. This is the purpose of this group. And, so that was an example of like, I guess, I really did need to slow down. And I felt I had gone into the retreat like with my own vision of what I wanted to get out of it. And I had a book, and I'll get to this later, but I had a book that I was wanting to kind of follow some of the frameworks that it set up. And my facilitator said, oh, let's do a survey of your directors and see what they want to get out of the retreat. Like, okay, yeah, that sounds good. And so we did that, and it came back. 50% of the book of the directors rejected the book. I'm like, okay, I guess we're not gonna like stick to that. So that was another example of somebody forcing me to be curious of like, what do your directors actually want to get out of this retreat? And then really pivoting, like, because that was like 7 days before the retreat, pivoting to a different direction, which ended up being really good.
Mm-hmm. So sometimes it can be really helpful to have that outsider.
Oh yeah.
To help facilitate that, because as the leader, there are the power dynamics, and yet having someone else facilitate that can also be really helpful to practicing curiosity when it's hard. So
yes, absolutely. And I give my directors credit, and I knew there was some pushback about the book, and like, oh, I'm interested in hearing about that. And then when I heard 50% rejected, like, oh, okay, well, all right.
What is one thing that sparks curiosity for you in your own life?
Well, I love podcasts, so I'm always looking for the next best, next good podcasts. And so that does spark curiosity. And I mentioned earlier about this book, and I had heard a podcast with Keith Ferrazzi, who's the author of the book, Never Lead Alone, 10 Shifts to Go from Leadership to Teamship, and I was really intrigued by it. And it made me curious and think about my own leadership and the dynamics of that director's team and how I do want to shift from the leader Janice to hey, we're all leaders and we're peers and we're peer leaders, right? And so that's what drew me to read the book and then have the team read the book. There are parts of it that are really valuable and useful and things that we have used and are that will help us, be better leaders. But it's also, like I had mentioned, there are problems with it. It's not perfect. It's not oh, it's just a formula to follow. It needs to be pieces of it. And then we need to make our own formula at Neighborhood House for what works for our culture as an organization and as a team. So, just listening, I'm always learning. So I'm always listening to podcasts. I go to conferences, I read, I meet with my peers, some of the people that you had on your podcast, are friends and colleagues. And so, I'm always learning from my peers and always wanting to improve and do better. So we can do better for our community. Yeah.
Thank you so much, Janice. And how can people get connected with you?
Well, I'm on LinkedIn. My handle is just Janice Deguchi. So please reach out. I'd love to hear from you.
Janice, thank you so much for sharing your wisdom today on the Curiosity at Work podcast.
Thank you, Julie. It was great to be here.